Hey guys, so welcome back to my channel. I know it's been a while since I have posted. I think it's been almost 2 weeks. I apologize. I have like no voice today. Or it's been like this for a while. I think it's more allergy related. I don't know why because I seem to be okay. It's just that I have been dealing for the last 2 weeks some horrible off and on and off again flare-ups or other issues, and I don't know what's going on with me, honestly. I have more questions than answers at this point. I have been dealing with stomach issues. I had my first like panic attack in the middle of the night the other night. Don't know why that was. I don't know if it was just an adrenaline dump that can happen when you have POTS, and I've just never had that before, and it just was kind of weird. I've had I've noticed my headaches have been weird, even though I've been getting my Botox treatments. I've noticed since yesterday, it's been really weird that I noticed that when I'm sitting up, like I'm just sitting up, or when I'm standing, I feel like this intense pressure in my head and literally the back of my head and stuff. And upon Googling it, the only thing that comes up on everything would be CFS, which is like cerebral fluid leakage kind of thing. It's in your like spinal fluid, or not spinal fluid, but like probably like your cerebral, like it's like back here. It is like leaks fluid like from your brain and stuff, and it can cause the pressure to be different in your head. And it's weird because it's kind of scary sounding. But the only way to know for sure, I'm guessing you would have to do like an MRI or something. But it's weird because it's like, I don't like it. I don't like how I feel, but I feel better when I'm laying down. And that's not functional for me, considering I thought I was doing pretty well since I moved in my room. And I have been, I finally got all the furniture moved in, and I'm now starting to unpack some of the boxes and stuff like that I had with all my other smaller things and everything that was on top of, like, bookshelves and stuff like that. I'm now starting to unpack all those and put everything back where it was. It's like I'm trying to get this done. My goal was by the end of the month, and then so in September I can concentrate on our living room and get that more of like looking like a living room instead of just like a catch-all little piles here and there, and it's just kind of like, I mean, it's not that bad. It's just there's small clutter piles everywhere. So I just need to kind of go through it all and clean it out. And that was going to be my goal for September. And then in October, I was going to work on it again in my office and start also cleaning out. We have a front room area towards the front of the house, and it's full of boxes and everything like that when we moved in here. And I still have yet to go through them all. So I would like to clean all that out, because that would be the next room we were going to renovate and update. It's not a whole lot to do in that room. It's just more of like texturing the walls, painting, flooring, basically, and that's pretty much it. But I just wanted to, I had these things, I wanted to get it done and be all the junk basically cleaned out by the end of the year, which is very feasible because we still got we still got a couple more months before the end of the year. So I'm not trying to put a whole lot of stress on myself about it, but it's so annoying when my body doesn't want to cooperate. And I try not to let it get to the best of me, because then it just kind of stirs up anxiety, stress, and then it gets a big old snowball. So I'm trying to try to let it chill. So anyways, the weirdest thing is that my the newest thing, it would be my headaches and stuff like that. It goes away sometimes it doesn't. But here lately, the last day or two, it's been constant when I'm sitting up. So I'm sitting up now. I'm kind of fighting it at the moment. And I'm kind of not I'm just sitting up. I have like lower back support right now because I have my pillows behind me, but I'm not leaning back. There's something actually literally behind me from like my lower back and up. So I'm really just using my body as support. And I'm sitting on my bed, so it's not like it's anything hard. And I don't know if it's my spine. I don't know if it's a cervical thing on my neck area. I don't know if there's something causing it. I know there's got to be something around that general area because the rest of my spine, the rest of my back feels fine. It's just that area. And I know that has a lot to do with anything out of that area can cause anxieties. It can cause dizziness. It can cause all these issues. And that's what's making me wonder. The only way I would know that is if I do an x-ray, and my neurologist doesn't do stuff like that. When it comes to the spine per se, he does mainly the head part. So I would probably have to go to a chiropractor or something along those lines and see about that. Now, thing is getting my insurance to pay for the chiropractor because they don't still see it as an actual doctor thing, so necessity thing. So again, I may have to pay out of pocket for that one, but I don't know. But anyways, so I'm kind of battling that currently. I did go see, finally got my impressions done. I put it off a week since my last video. I told you guys I was going to go the next day to go get it done, but I actually put it off a week because I had a flare up and I was just going through so much issues physically. I didn't want to add something else to my plate and have anxiety and all that stuff. So I put it off a week and then finally said, okay, I've already paid for this. I just need to go and get it done. I did not expect what I thought I was expecting. I thought I was going to be like a go in. They don't do they do the 3D, but they also do like the goop stuff. They do the goop stuff first to make the mold, and then they do the 3D scan. Well, I was expecting the little goop stuff in the tray and everything. I thought, okay, I can just handle that. I was thinking, okay, go in, tough it out, get that part done, and then I'm done. I can leave. But instead, after he did that, we had to do it twice because the first part wasn't good enough. The first part, the tag put way too much goop on it to the point that literally, before he put it in my mouth, a big old clump fell right on the napkin part of my chest. I'm like, oh my God, I'm going to choke on this. And then my dentist decided to do to do a soft reline on my old denture, my upper denture. And because he wants me to start trying to wear it again. The soft reline's great. Problem is though, getting a soft reline, I don't know if you ever wore dentures and you've ever had a soft reline done in office, it is awful. I'm sorry. I literally was toughing it out. I feel like I was gagging. I was literally trying my hardest to get through it. And it's the longest 5-6 minutes ever. You're literally waiting and you're like, you're told to bite, but the more you bite, the more goop sticks out and you're like trying not to do as much. And then when we got ready, as it was time to pull it out, I sat up. I kept almost like gonna throw up, I was just like gagging. It was like dry heave. I was like, every time we moved it, because he kept, it kept coming. It was so stuck to the roof of my mouth, which is great. It's a great suction. But it kept hitting, it was right on the edge of my soft palate. And I'm like, I just kept heaving. And we finally got it out. And once he got it out, I was fine. But it was like, oh my God, I never really gag at the dentist. No matter what they've ever done, I really hardly have ever never gagged. I'm not one of those people that would do. And, I'm legit, I tough it out. I was gagging and I was like, of course, my poor husband, he goes back there to be with me, but it's not the greatest support system for me because when it comes to needles, it comes to the impression part, it came to the, the gagging part, his back is turned towards me. It's like, what is the point of you being here if you're not going to sit there and watch and be support and hold my hand if you're turning away? You might as well go sit in the waiting room, So it's craziness. So I'm sitting here thinking, what am I going to do? So I'm like, I have to be my own support system here. Typically, I have my daughter because she's like me. She can watch it all. It doesn't bother her a bit. And she understands that it's about me and not her, And so she does whatever she can to help. And unfortunately, of course, fortunately, but unfortunately, she's at school. So it's like, she's in college. She has her life. So she couldn't be there. And so I was just like, I got through it, and I told the dentist, I was like, well, it's got great suction. I mean, but once we got it done, I was fine. Then he wanted to do a 3D scan, which took again forever. And then during that time, I was almost like I was going through like my panic attack started to rise, even though I took a diazepam before. Like I sat when I was sitting in the waiting room, I started feeling the feelings coming on, and then I took a diazepam because I always bring them with me. I felt like maybe it wore off. I don't know, because at the time that's when everything started to rise, and I think I'm needing an adjustment in my Effexor because I think that I need a higher dosage. So because I'm starting to have more panic attacks than usual lately, and I don't know if it's the stress from thinking about the dentist part, thinking about me unpacking stuff, and then having these other elements in my body and my flare-ups on top of it. So I don't know. My sleep the last few days hasn't been the greatest. I think last night it was a little better than it has been last couple days, but it still hasn't been the greatest. Even despite being in a new bed and stuff, I'm still trying to adjust it where it's an adjustable bed. I'm still trying to adjust whether I want it where I want to be as high or low as I want. I'm so used to sleeping flat, so I'm still kind of sleeping flat a little bit with a slight tilt on the head part. But and then I've been adjusting the pillows and the stuffing that's in the pillows. I mean, that I've been trying to figure out because I want something more, supportive. And I don't want to spend more money on more pillows, but that may or may not work because pillows can be expensive. So especially ones that you think are going to work, that are supposed to be for like your cervical support, head support, and depending on how you sleep. I sleep all over the place, so I don't know. Between that and then my husband thinks our AC maybe low like Freon or something, so we're dealing with that. So it's been hot, cold in this house. And so I'm still adjusting to that. And then now I just got me. So, and my flare-ups. So I'm a ball of mess. I mean, I'm not trying to sit here. I don't want to spend this whole video on me venting about everything, but that's what I've been dealing with, guys. I mean, at least I got through the impression part, the dentist part. I don't go. I have an anticipatory date of extractions on the 17th of September, which I'm super nervous about it, but at the same time, I'm also like trying not to think about it at all. Like, it's just another date. I got an appointment. Just go and get it done. I'm trying not to think of it. It's not a big deal. It's not a big deal. It's not a big deal. But it is a big deal. You know what I mean? And the good thing about it is that most of my extractions are going to be simple extractions, which means that the teeth only have like one root versus, a bunch of molars and things like that. I have no impacted teeth. I don't have any infections. So that's a plus, They told me anticipated 2 hours. I don't think it's going to take that long. I don't know if I want to deal with the only thing is that with the Novocaine or laughing gas, it can cause me my heart rate to spike, and I can get anxious and jittery, and that makes anxiety even worse because I'm already like that, and I don't want to feel like I'm going to pass out, and then, when we have to cancel or we have to reschedule or something, I just want to get it done with, because this is for one of 2 surgeries I have to get done. The second surgery is whenever I finally get the actual post put in my bottom jaw for the snap-ins. So that I'm definitely looking forward to because that is something new to me, totally new to me. I've had extractions before, so that should be no big deal for me, right? But doing the post part, they're literally going to cut my gum open and they're literally going to drill into the bone. So it's like, oh my God. And I'm going to be awake, all this time I'm going to be awake. I'm not going to feel it, but I'm going to be awake. And maybe have the red hair gene, which means I'm more prone to feel. And so I need more numbing stuff. And it's just going to be like, they won't know how much they need to give me until I feel the pain. And I'm like, I don't even want to feel that. So luckily, this dentist has done me before, and hopefully he can look back at my chart and see how much Novocaine took before in the past with extractions. Maybe he can start with that dose and then we can go from there. Of course, we can only get so much because you don't want to do too much. It would cause, basically an overdose, and you don't want that. That's a big whole other 911 issue. So I'm hoping my extractions take probably about an hour or less. I'm going to try. I looked up. I don't think my extractions are going to have to deal with anything with drilling. So just the sound of the drill, even if it's on TV, just the sound of the drill just cringes. I cannot stand. It raises my anxiety. I cannot stand that sound. So I don't want to hear that. But my thing is, though, so I think that they're not really going to probably drill since I have no impacted teeth. So I'm thinking all they're going to do is he's going to numb me up, loosen the area around the gum and the teeth, and then basically take some pliers and kind of wiggle the tooth out and basically pop it out, clean it up, put some stitches in probably, and then do the next tooth. I'm hoping it's going to be kind of like that boom, 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 boom. I have like 9 teeth to do. So hopefully that's going to be it. I have a good couple weeks to think about all this, and I think that's probably another reason why I'm having flare-ups now and having anxiety and all these issues, because it's, I'm going to be constantly thinking about it until it's over with. And then I have to deal with the healing part, which last time I got my teeth extracted, I had a really bad go at it because I had developed an infection and up in the hospital, and I'm scared that's going to happen again. I don't think it will, but because it's a totally different dentist, totally different area, totally different everything. So I don't think that would happen again, but it's still going to be in the back of your head. If it's happened before, you kind of wonder if it's going to happen again. So I'm going to have to deal with that. Plus, I also have to deal with immediately putting in my temporary as well as my upper's got to be in the day I get the extractions taken out. I'm not used to wearing my upper anymore, but he wants me to start getting used to wearing it before I get my extractions done, so there'll be one less thing I kind of have to worry about, and all I got to do is get used to wearing the bottom as I'm healing. And then I got to start learning to do everything all over again. I talk funny with it on. I doubt, I feel like it looks weird on me. Not only that, I don't think the line is right with my face. I don't know why. It's the same denture I've had, and I have photos of me wearing it when I first got it, and it was perfectly straight, but now it doesn't seem straight on me. I don't know why. I don't know if my face has changed or something's just not right. When I put it in, it seems like the line is off. The area between the two front teeth, and then where your nose is at, it's supposed to line up right here. It feels like it's more like off the side, like right here. It feels like it's way off, and I don't know why. It's weird. I don't know what would cause that. Because literally what causes that is literally the make of the actual denture. But if it was normal before, all we did was reline it. It should not change the teeth and all that. The liner is just the tart that goes on the gum. It should not have anything to do with the teeth and the lining. So I don't know why it's doing that. I don't know if it's me and I've changed, and that could possibly be the cause. I have no clue. But anyways, guys, so majority of this video is me, kind of venting, airing out how I feel about everything. So I am going to probably cut this video, short now, because I have therapy in about 20 minutes. So I'm probably going to lay down for about 10 minutes or so and, close my eyes for a second and then breathe. And then before I have my therapy session, because I have to sit up and for an hour and talk to her. My therapist is great. I mean, it's no big deal. I canceled last week because I didn't feel well, so I didn't want to cancel this week on her. She's helped me a lot too as well. We talk about a lot of stuff like this on there with her, as long as of course, all other things I talk to her with about stuff. So yeah. But yeah. So my main thing about this video is mainly my teeth issues. But I am looking forward to finally getting it done. I know this is a new beginning for me. It's a new journey for me because I remember when I first got my upper cheek done, and I posted it all up on YouTube, and I had a whole playlist of, and everything, and somebody commented, and they were so rude about it too. Someone goes, "Oh, they look good, but now you need to get your bottoms done, or your bottoms need to match." Like, dude, you don't like. Can you be any more ruder? So if that person is still here, or I ever come across this video again, just so yeah, I'm getting the bottoms done now, finally. I mean, it's only been like two years now, but you realize I have no dental insurance. So, and if you look at the prices of stuff like this, it is expensive. I mean, if my dentist didn't give me a sort of a discount, I would have my bottoms would literally cost me $20,000-$30,000 for the snap-ins. And that's just for 2 posts. And that's a minimum. You have to have at least 2 posts. I mean, it's ideal to get 4, but that's just for 2. So I don't know about you, but I don't have $20-something thousand laying around just for my teeth. And I don't have insurance for it either. And I mean, and who has the greatest credit in the world to get that much money up front? And I'm sorry, but I'm not going to go for those people that say, "Hey, we'll give you a loan and you're paying 300% interest." I'm like, no, I'm not paying, you'll be paying back 3 times the amount that you could have just paid out of cash for if you just saved it up. So I'm grateful my dentist is giving me a good discount off this. Plus, I am grateful for our local VFW is helping me out. I'm grateful that, I guess I should be grateful for my, piece of crap of grandfather was in the Army and so forth, which helped me become a member of the VFW, which also helped me get the funding that I can do this. So at least he did something great for in his life, because, yeah. But anyways, yeah, that's the only way to be able to afford this. So if you are on your dental journey, if you are struggling financially, whatever, there are resources out there, but it is you have to kind of look. Look in your family history. If you have anybody that was a service member at any point in time, no matter what their rank was or whatever it was they did, they were a cook, a nurse, whatever. If they did any kind of service, look at your local VFW, get their DD 214, I think that's what it's called, form, and submit it and become a member of your local VFW, and then check them out and ask them, about, do they help out their members when it comes to, financial help and stuff like that, and health and medical bills and things like that, because a lot of them do. A lot of them have funding for this. And so you might want to double check and see. Now, I'm getting mine in increments, so this is why I got to spread all my stuff out, but it's going to get done. And I'm grateful for it, you know what I mean? And they're not asking anything of me to pay it back or anything like that. But of course, I probably will, with some kind of service of some sort, just to show them I'm grateful. If not, if I don't do anything, sweat equity, whatever it is, pay them back for it, I'm going to definitely probably send them a good heartfelt letter telling them how grateful I am for it, because I don't want them to feel like I'm just taking advantage of the situation. So yeah. But anyways, guys, definitely if you're looking forward to something like that, check your resources. There are some out there. You're just really going to have to do the work and really try to find it. They're not going to advertise it. Nothing hurts for them just to ask. And if you hear the word no, then you hear the word no. I mean, move on. Or if you have to, try to save up some money, put back $100 a month if you can afford that. I mean, next thing you know, in 1 year, you got $1,200. I mean, that could probably help pay for some extractions if you need them. And then another year, you'll have, another $1,200. And then that's $2,400. I mean, you're almost there. Even if you get the basic denture, you got something that's better than what you probably have now. So I'm just saying. And if you can never think you could ever afford it or whatever it is, guys, it's okay. It's fine. Don't listen to the haters. It's just one of those things that, the cards you're dealt with, and it sucks. But it's it is what it is. That's what I feel like about a lot of my autoimmune issues that I have. It's the cards I'm dealt with, and this is the things I have to deal with every day. And I have good days, I have bad days, and it is what it is. So, I feel like sometimes I take 3 steps forward, I end up taking 5 steps back. So it sucks. And sometimes it's 2 steps forward, but 10 steps back. And it's like I never get where I want to get to. But if I look back and think about this, how was I a year ago, 2 years ago, 3 years ago? I think in some aspects I have gotten better, you know. In other aspects, I've probably gotten a little worse. But maybe me getting a little worse will give me answers of what I need. And maybe if I only get a diagnosis or a treatment or something, so I can get better. So that's the way I think in life. But anyways, guys, I know I said I was going to make this video short about 10 minutes ago, but here I am, still mumbling on. But I just want to tell you guys, thank you for watching this all the way through. Thank you for the likes. Thank you for the shares. Thank you for the comments. And I think this was one person on here. I don't know if you're real or not, but you claim that you gave me money on my PayPal or something like that. First of all, there's no way, because I never post my PayPal on here. So, and there's nowhere on where my PayPal is. So I don't know what you're talking about. Second of all, if you are a real person and you want to help me financially or whatever, I do have a Cash App. It is, of course, the $ Meandering Mary, all one word. I also have, that's pretty much it, really. As far as, the whole, if you want to help me financially, I'm not expecting anything. But all I really want, as far as from you guys, is just for you guys to watch my videos through, for you guys, I'll be all the way through so I can get my watch hours, and to help me grow this channel as I continue on my journey. Like I said, this channel is not always going to be about me talking about me and my health and all that stuff. Right now, that's what it is. But it's not always going to be this way. I'm going to eventually do other things that has nothing to do with me, per se. So, but right now, this is what I'm giving to you guys. I think that's it. So, I hope you guys have a great day. I hope you guys have a great week ahead. And, yeah, fall's coming up, but it doesn't feel like it. It's still like 110 here in Texas. So, yeah, if we can I'll be happy if we can ever get down to the 80s. It'd be great. But, and we really need rain desperately. I love rain. I'm obsessed with rain, thunderstorms, all that stuff. I love that stuff. I sleep every night with rain and thunderstorms on. It is something about it's comforting to me. So I probably end up listening to that when I'm at the dentist in my earbuds when he's working on my teeth, extracting them, because it calms me down. Who knows? But anyways, guys, I will see you guys next one. I hope you guys have a great week ahead. And I will see you guys in the next video, which will probably be maybe next week, or maybe I don't know when at this moment, but stay tuned and I will talk to you guys later. Bye.